if you are a lady and you are seeing my video and you are struggling with endometriosis, if you're having any kind of endometriosis, please, this video is for you, and I will advise you to watch it to the end so that you can understand what is happening to you and how to start fighting. A lot of women are struggling with endometriosis. They don't even know what is wrong with them, and hospitals are not doing better to explain well so that they will know what is wrong with them and how to overcome it. Okay, this endometriosis is just like a sandy termite line on a wall. You see this image I'm showing here? I'm using it to describe endometriosis. It's just like a sandy termite line on a wall. You might try to scrap off that line and you'll feel like you're okay. No, the main problem is still inside the wall. Okay, the problem is not solved. So this termite is still very much active inside the wall. Okay, so in the same way, I'm just trying to say that even if you go to hospital to remove the endometriosis through surgery, maybe you try to remove the lesion of endometriosis, just like the termite line, the lesion of the endometriosis, some people might go for surgery to go and remove it, thinking they are going to be fine. No, the problem will still come back worse. I don't know if you understand me, because a lot of symptoms used to even come back worse even after the surgery, or for some people taking hormonal drugs to suppress the endometriosis for months without you seeing your period. At the end, once that period will land, it will be a whole problem for you. Okay, so see here, that endometriosis is just like a line, that termite line on a wall. It's just like the lesion of endometriosis. If you go to hospital for surgery, they might scrap it off, but that is not the cure, because the termite is still in the wall. I'm trying to tell you that something deeper is eating deep inside your system. Not the endometrial lesion that has been spread in your system is the problem. You need to correct the error from the root to be able to reverse it. Okay, you know, this endometriosis is actually when the tissue that's supposed to be at the lining of your uterus start to grow outside. Okay, they start growing where they are not supposed to grow, and this causes a lot of pains. Okay, this endometriosis is actually an inflammatory disease, which causes a lot of struggles, even fertility struggles, pains, period pains, as in even nausea, vomiting. There is no kind of sickness, there is no kind of symptoms that doesn't come with endometriosis. So people struggling with endometriosis will understand better. So that's why I said you should just stay with me for a while to understand more. This endometriosis is not just a womb issue. It affects the entire system. It can disturb the hormone, it can weaken the energy level, affect digestion, strain the immune system, and even impact emotional well-being. Okay, that's why a lot of women with endometriosis are struggling. Like, these people are dying in pains. These people are dying in pains. It's as if their body is broken. But let me tell you, your body is not broken. This is a signal that your immune system needs care. It needs balance. It needs support. Those signals should not be ignored or silenced, but should be understood. And the endometriosis has different ways it spread in your immune system, which makes them to have different names. Okay, they're actually one thing, but the way they move in your body is what is making them to have different name. Just like the one they're calling adenomyosis. This adenomyosis occurs when endometrial-like tissue start to grow inside the muzzle wall of the uterus, instead of staying on the inner lining. Okay, so this make the womb to thicken, to be swollen, and it will become very painful. Women often experience heavy bleeding, severe cramp, clots, pelvic pressure, and all. Okay, a lot of pelvic pressure, especially when they are seeing their period. So it's all because of adenomyosis. Okay, so the endometriosis itself is the one that happens inside the uterus. Okay, it normally disturbs the uterus, but the one that is happening in the muzzle is actually adenomyosis. Okay, the difference between these two, endometriosis and adenomyosis. And there is another one that is called, that is umbilical endometriosis. This umbilical endometriosis, this one is becoming, it is even becoming more and more rampant these days. You know why? Because almost a lot of women are struggling with endometriosis, like umbilical endometriosis. This is when the endometrial-like tissue start to grow around your navel, like that, your belly button. Okay, and this causes swelling, pains, even dark discharge or bleeding from their belly button whenever they are seeing their period. Okay, so this endometrial, oh my goodness, it's God that will help women, honestly. So apart from that, this umbilical endometriosis, we still have another one. They call it thoracic endometriosis. This is when the endometrial-like tissue is found around the chest area, especially the lungs. It can cause chest pain, shoulder pain, even shortness of breath, or coughing out blood whenever that you are seeing your period. I beg, Whenever you are noticing shortness of breath, I beg you, run to hospital to go and check. It happens because the misplaced tissue respond to hormone, just like womb lining, even though it's very far from the womb, because the way it is spreading. This type of endometriosis is rare, but it's very serious and even more dangerous. This shows that endometriosis can affect every area beyond the pelvic. Like, it can go anywhere in your immune system beyond the pelvic. So it's not all about your womb, your pelvic, or whatsoever. It can go to your navel, it can go to your lungs, it can even go to your anus, anywhere. Hey, oh my goodness. See, healing begins when you stop fighting your body and start restoring the internal environment. Just as a termite stop when the wall is treated from the inside. Endometriosis can calm down when inflammation is reduced, when hormones are balanced, yes, and also supported with natural herbs like fertility herbs, okay. And when you also couple this with healthy lifestyle by eating clean food, you will see a lot of changes, okay. And with the right guidance, patience, and consistency, trust me, your body can move towards balance, relief, and restoration. And that is why I'm here to tell you the herbs, the procedure, and the things you need to do to start fighting endometriosis naturally. I'm trying to tell you there is deeper work to do in your immune system. Yes, you have to handle your hormones, you have to reduce inflammation in your system, you have to support like liver detox to clear excess estrogen in your system, okay. And that is what all these fertility herbs I mentioned is doing in your system. You also have to eat clean, eat healthier meals, and change your lifestyle. That's how you will overcome endometriosis. This is not a quick fix, so it requires consistency and lots of commitment. Endometriosis is not a child's play. Yes, it's not that easy. If not, hospital would have given you a solution. All the women that have gone to hospital to take injection to suppress their endometriosis, or maybe have taken injection one or two, or maybe they have done one or two surgery also just to try to manage the endometriosis, but at the end is even worse, because I have a lot of them in my inbox with their different stories. These people are dying in silence. Oh my goodness, I don't know how to start. I don't even know why people are not talking more about this. Women are dying in silence. Have you seen women with umbilical endometriosis? Have you seen their navel? Please, if you are a young lady, this video is not just for people that are already having endometriosis. If you don't have endometriosis now, this video is also for you. If you are noticing any kind of unbearable pain whenever you are seeing your period, my dear, it might be endometriosis. If you're having any kind of tingling, as in stiffness around your navel or pains around your navel, it might be endometriosis. The earlier the better. If you are noticing any kind of leg pains, muscle pull whenever you are seeing your period, it might be adenomyosis. I'm just telling you, you have the chance now to start fighting. Endometriosis is not a child's play, but we are doing it. You can see this testimony here. Yes, we have a lot of them, and some people have already overcome. And the same thing will happen to you if you start now. Thank you.